Today we're going to talk about hip replacement. It's a very common procedure used when a patient is complaining of severe osteoarthritis of the hip or fractured hip. The goal of total hip replacement is to decrease pain, improve mobility, and restore function of the hip joint. Total hip replacement is removing the damaged bones in the hip joint, and as we know, hip joint is one of the most stable joint in the body. We call it ball and socket joint, and that kind of procedure we need to take off. The surgery is about taking off the damaged cells and replacing it with artificial hip. There is two types of hip replacement surgeries. One is partial hip replacement and the second one is a total hip replacement. That all depends on the condition and how much damage occurred to the joint itself. Physical therapy is a great tool to assess and treat such a condition. Good treatment for these conditions starts with good evaluation. When we evaluate a case, we basically find out what is the problem, what caused this hip to go bad. If there is any discrepancy, if there is any postural problems, if there is any muscle weakness or muscle imbalance, we need to find out what led to this thing to happen. Even if the patient goes to surgery, we need to also work on the issues that the patient might have, like as postural correction, muscle imbalance needs to be corrected, leg length discrepancy needs to also be addressed. We have three elements we work on with the patient in such a condition. First of all, try to control pain. Second, to increase range of motion in all directions. Third is to increase muscle strength. By focusing on those three elements, we can work gradually to improve the patient's function. By improving and increasing their muscle strength, range of motion, we can gradually start to go to some functional tasks such as walking, going up and down the steps, jogging, and running. Our goal in physical therapy is your goal. So we need to agree on our plan of care together. We need to put the goals together and we need to work together hand by hand to achieve these goals. And the only way we can get this to happen is by your participation, your cooperation. You need to follow our instructions, follow our home exercise program we give you. You need to attend physical therapy sessions regularly and be cooperative, do what you're supposed to do, try to push yourself to the limits we set for you so we can achieve our goals quickly and efficiently.